Diagonistic and Remedial Teaching, Chapter 8. In sheeted examination, one or two questions are regularly asked from this chapter. Mostly questions are asked from the topics like diagnostic test in school subjects, remedial teaching, etc. Diagnostic test in mathematics. Just as a doctor diagnoses a patient to find the nature, type, and extent of his disease before prescribing medicine, a teacher of mathematics applies diagnostic test to diagnose the difficulties and weakness of the student. Through his test, weakness and difficulties of students in the instructional material consisting of one or more types of mathematics are diagnosed. In diagnostic test, both background and performance of the student are needed. Diagnostic tests are qualitative, not the quantitative. Diagnostic test can easily be understood with the following example. A bottle contains milk. Two questions can be arise. How much milk is there in the bottle and why it is full or empty? Question about the quantity of the milk. How much milk comes in achievement test, while about quantity. Why the bottle is empty or full comes in diagnostic test. Hence, from the above example, an easy understanding can be made that diagnostic tests are qualitative, not quantitative. It undertakes to provide a picture of strengths and weakness of the pupils in learning. Types of diagnostic tests. Diagnostic tests are mainly classified into two classes: educational diagnostic test, clinical diagnostic test. Educational diagnostic test. These tests are related to study matter or study material diagnosed for specific level or understand of education. These tests diagnose disorder of material according to level of class. Clinical diagnostic tests. These tests are related to hearing, vision, and other things that cause hindrance in the course of the child's learning. Characteristic of diagnostic test. A diagnostic test have following characteristic. It finds out weakness or deficiency of a child in learning of a content. It is an effective tool for teaching that helps in planning and organizing remedial teaching. It is a base to form tutorial groups so as to help the poor student to develop their performance in removing their difficulties. It arranges the items in learning sequence so as to help the students in transferring of learning positions. It adopts objective type test only. It fully emphasizes on all learning and teaching points. It needs an expert or specialist to identify the causes for wrong answer. Methods of diagnosis. Following methods are useful for diagnostic approach. Testing method. It involves several types testing procedure as follows: educational testing method, psychological testing method, clinical testing method. Observation method. It is subjective method and applied only for the children for progress and diagnostic. Diagnostic test in school subject. Different subjects in different school are according to level of class. Students face several difficulties, especially in language and arithmetic. To remove the doubts and difficulties of the students, different kind of tests are diagnosed, which are designed, which are given below. Diagnostic reading text. Diagnostic reading include the following subtests: poetry comprehension and appreciation, vocabulary in different areas, meaning of sentence, paragraph comprehension, rate of reading and comprehension of prose. Diagnostic mathematical skill test. This test is used to detect the following type of errors committed by the students during mathematical operations as addition, subtraction, multiplication and division. Carry over in addition, borrowing in addition, placement of decimal error, borrowing and reducing one from next, nothing wrong numbers, tables are not remembered in divisions, tables are not remembered in multiplications. Important steps of diagnosis. There are 5 main steps of diagnosis using which the process of diagnosis is forwarded. First of all, we try to know about the student who are facing his problem. For it, we use different methods about which we are read above. We try to know about the area or type of questions where the child does mistake. After finding the nature of mistake in step 2, we try to know the reason of their mistake. This is difficult step. In this step, mainly logic of the teacher's work. After knowing the reason in step 3, we think about its solution. There is not any certain rule for it. It depends on the nature of the problem. After solving the problem, the process is not yet completed. After it, a teacher should think what we should do so that their problems may not occur in future. Remedial teaching. The term remedial teaching, as the name suggests, stands for the teaching or instructional work carried out to provide remedial measures for helping the students or individual students in getting rid of their common or specific weakness or learning difficulties through diagnostic testing or some other measures carried out for such diagnosis. Diagnosis thus provides a solid base for hypothesizing the general and specific causes underlying the weakness or learning difficulties for the students of the class or group or a particular students. It is thus true that the diagnosis is the remedy for the removal of the difficulty. Thus, depending upon the general or specific nature of the weakness or learning difficulties of the student, we have to take appropriate steps for the organization of remedial teaching for the needy student. Aim of the remedial teaching. Following are the main aim of the remedial teaching. Remedial teaching is identifying slow learners and giving them the necessary guidance to help them overcome their problems after identifying their areas of difficulty. Contrary to what is said, remedial teaching is done perfectionally without identifying their areas of difficulty and underlying causes for lagging behind. Some students are unsympathetically branded as blockheads without an earnest attempt to know the real cause of their slow learning. The objective of remedial teaching is to give additional help to pupils who, for one reason or other, have fallen behind the rest of the class in the subject of mathematics. Children with learning difficulties have the same psychological needs and characteristics as other children. Some of them, however, may be less able to organize their perception or to comprehend abstract ideas and concepts. Some may have poor memory, poor level of motivation, short span of attention in work situation, or associated behavioral problems. It must also be noted that most of the learning difficulties pupils in remedial class encounter may not be within the child but are relative to the context where the learning is taking place, such as the family background of the child, the physical and learning environment of the school and the pupils' peer group. It is essential for the remedial teachers to understand truly the strength and weakness of their pupils so that appropriate teaching approaches can be adapted to meet their individual needs. The ultimate aim of remedial teaching is to help pupils who have fallen behind to learn to the best of their ability and to bring them back into the mainstream classes as far as possible.